Welcome to our Healthy Thursday conversation. Yesterday was a holiday. We talked about stress at the workplace, and it was so helpful. It is my prayer that our next conversation today on a Healthy Thursday will be equally as helpful to all of us. Once in a while, we all get depressed, but most of us don't even know what it is, because sometimes we say we're moody, like you're sad today, you're excited the following day. What really is depression, especially when they say it's an illness? My guest is from the Pantai Hospital, Dr. Daniel J, who will help us digest this issue. And I'll activate the phone line so that all of you watching us can also join us with your views. So good morning to you. Doc, thank you very much for coming through.
Thank you.
Where should we begin? I mean, I think first of all, the fact that this is an illness that is diagnosed.
Yeah.
How often do we diagnose people?
Okay, so in our setting it's quite common. So usually we see people, maybe in a week you'd see at least within the week I'd see more than 5 people with depression.
Okay.
Yes, but then for everyone that you diagnose, you know that there are a lot more out there who probably would go undiagnosed, or their symptoms are not that severe to get them to your facility, but they may have gone to a general facility with other symptoms that may not point directly to depression.
Okay.
So it's quite common. I mean, the WHO estimates that about 300 million people worldwide have depression, but not all these people get the care they need.
Interesting. Explain what depression is, first of all, with the signs and the symptoms, and then we'll get into the details of that.
Okay, so depression is an illness, as we stated earlier. To diagnose it, you need certain symptoms over a period of time. So usually we say over 2 weeks. Then you need certain features. The commonest features we look out for a sad mood or depressed mood. Usually the person feels down and feels sad. Then there's another aspect where the person loses interest in things that were previously pleasurable. So they lose interest in all things. The things that you used to do normally, they wouldn't want to do them again. Like the interest is just gone, so they just stop that. And then some also start feeling this low energy. So before even the day starts, I'm feeling tired already, I can't do anything. That those ones are usually core features of depression. Okay. Then there are other symptoms. So it gets to a point where the person feels hopeless or worthless, like I'm of no use, what else can I do, and all that. Then they also have difficulty concentrating. So if they are with a particular task, they can't concentrate and do it. Their minds are all over the place and all that. And sometimes they often feel guilty about things. Just feel guilty, maybe this is happening because I did this or I did that. So like some inappropriate guilt comes in. And then some people also have changes in their appetite. So either eat too much or they eat less. Then it can affect our sleep too. So people also can't sleep at night or they're oversleeping. Now the symptoms may also have, the disease can also affect, changes, we can see changes in people's weight. So they may lose weight or they may put on so much weight. And then when the symptoms are that severe, you have people come in having suicidal thoughts. So they think of, okay, so I think I've reached the end, I have to end it. So they start having thoughts of ending their lives. Others go on to attempt it, and unfortunately some of them are successful.
It almost sounds like it's other situations that would put somebody in this mood of depression. Am I correct? Is this something that can drive a person to depression?
Okay, so there are stresses, or we have risk factors. But what exactly causes the depression, we wouldn't be able to tell. But we know that it's an interaction of certain factors. There's genetic component where, okay, so if there's someone in the family who has depression or something, you also are at a higher risk compared to the general population of getting depression. So there's the genetic component to it. Then you have the stress, because for some people, you may not even have a stressor, but then others, you will also be able to identify a stressor. The stressor may be probably some social circumstances, or for some people, some abuse is suffered at an earlier stage in life, maybe marital issues, job loss, and all that. And again, people who also are diagnosed with chronic conditions, like, okay, I'm being diagnosed with a cancer or something, it doesn't feel very comfortable. So, the person would have to be worried about it and may get depressed alongside the medical condition. So these are some of the stresses. But it's the interaction of these factors.
But how can one suddenly be sad or hate him or herself? How do you get into a mood like that? Okay,
so as I said earlier, it's an interaction of the factors. For some people, they may not even have anything, any stressor, but then it just happened that they start feeling down like that, and then it goes
So
on.
suddenly I feel alone.
Yes,
I feel
but then
sad.
you start feeling sad, and other symptoms also come in. So maybe you start losing interest in things and all that. Then it progresses and it gets worse over time if you don't get the needed help.
At what point, because all these things can also be said to be normal.
Okay.
Oh, once in a while you get sad, you're unhappy, you hate yourself for taking a certain decision, it comes back. You replay it in your mind, but those are supposed to be normal, correct?
Okay.
How do I know that this is a bit abnormal? It's getting into the zone of it's becoming an illness or it is an illness.
Okay, so I think earlier I stated that we also give some time into it. So we say should have gone on for at least 2 weeks. Then again, with all this going on, I mean, those ones you mentioned, you can happen and you still go ahead with your normal function and all that. But when the person is depressed, it affects other aspects of their life, their social interactions, their working environments, their interpersonal relationships are affected. So you realize that it has some effect on the person's normal function. So then you know that it's worrying. It's not a normal, I'm just feeling sad today or I'm just not happy today.
Okay. So I guess the other question is, at what point should I run to the hospital? And which hospital really should I go? Because you are coming from the psychiatric hospital.
Yes.
And why are you smiling already?
No.
So at what point should I call on a doctor?
Okay, so I'm sure when you start experiencing some of these symptoms, as I said, you need a number of those symptoms over a period of time to be able to diagnose that someone is depressed. So if you start experiencing any of this, I think it's just fair that you can see your doctor. If you can go to the general hospitals, you can talk to them, and then if they need to refer you to the psychiatric hospital, you'll be referred. The thing is that most people don't like coming to a psychiatric hospital because of the stigma attached to mental health. But at least if you are the person in the general hospital sees you and tells you to come and see this person, this is what I think, I'm sure you'll be a bit more. But otherwise, people also walk into the psychiatric hospital. Sometimes it may be some vague symptoms that may bring them, then I'm having some headaches that is not going and all that. So when they come and then you probe further, you realize that this person actually is depressed, and those ones are just some of the symptoms or some of the features the person is showing. So if you start experiencing this, I mean, sustained over some time is affecting you, I think you can always go to the hospital.
So how would you begin the conversation with me if I walked into your office this morning to tell you that, for a while now, I've realized that like I am down usually, I am not happy, I think I'm sad. I don't enjoy doing the things I used to enjoy doing in the past. What would you want to find out?
Okay, so to start with, I mean, you said you came in and then you gave an introduction.
Yeah,
so
only because I've gotten a bit of education from you. Yes.
That's good. Okay, so
otherwise I will simply say I feel some way, like I'm not sure what is happening, but I'm just not happy.
Okay.
Yeah.
So usually you'd say you're not just happy. So what we'll try to do is to help you go through it, to try and tease out what are the other things associated with it. Because there will be some of the other symptoms that you may not even like say openly. So I'd like to know, well, when did it start? How exactly do you feel? Are there any other things related to it? Can you point anything that probably you think it's responsible for how you are feeling and whatever you are going through? Do you have a specific trigger? And I also have to ask about the other symptoms that we asked for. Then maybe generally we also ask about whether it's a family history, anyone you need to understand that. And then general medical assessment also comes in. Interesting.
Let me open the phone lines. If you're watching us and you have a comment or you've got a question, please give us a call. 0302 211 69102 211 69102. Let's talk about how one can get better. So this is actually something that you can even prescribe medications. Is that correct?
Yes. Yeah. So the treatments, usually there are two aspects to it. There's psychotherapy, which is more got to do with the clinical psychologist. That's more of talk therapy. So they will determine. So based on the severity and other factors after diagnosis, you decide, okay, so if it's mild, you can actually use it as a psychotherapy or the talk therapy. Your psychologist would determine which therapeutic approach will work for you. You have a number of sessions to work on it.
Okay, so would you refer me to somebody else?
Okay, so the clinical psychologist is different from us, but we work together. So yeah, so after everything, I would have to let you know that, okay, so I think I'll let you also start seeing the clinical psychologist because they're as important as the psychiatrist in the management of depression. Okay. Then if it's moderate to severe, then you have a role of the medications can also come in. So we usually combine the two to help the person.
Okay.
Yeah.
So the bit about the clinical psychologist, is it just, so this is a talk therapy, is
Okay,
that
so
it?
yeah, so but they have
Okay.
structured therapies that they use for depression. So they have various ones. They would have to choose one. I mean, you work together, you plan it together,
Okay.
and as you go for your subsequent sessions or your reviews, you work on it. They have a number of sessions that at least you have to have for the period for that session.
So this is treatable. I can get better.
Yes, you can get better.
Or I can get healed.
You can get better.
Okay, because it's not a condition that stays with you and you have to manage it
Okay,
throughout your life,
so
is it?
what happens is that for some people they get better and then they can relapse again.
Okay.
What I mean by relapse is that the symptoms may come back later. Yeah, so it depends on, other people will get one episode and after the treatment they'll be fine. But other people also get relapses or subsequent episodes which needs to be managed.
Okay, so if I live with, or I am married to somebody with a condition like this, you know, like I'm listening to you this morning, and the descriptions that you're given fit somebody that I live with, what can I do to help?
Okay, so I'm sure you can start first by trying to talk to the person, let the person know what you've learned and all that, and try and encourage the person to try and get help as soon as possible. You may volunteer to go with the person. I'm sure the person will feel more comfortable that way. Or try to talk to someone, and then maybe go to the hospital, talk to your general practitioner, and then you can pick it up from there.
Okay. Let's go to the phone lines now. Karim Idrisu is joining us from Bali. Hello, Karim. Good morning. Good morning, Karim.
Morning.
Please, you're on air. Let's hear you.
My name is Abdul Hakim.
Okay, sure. Oh, so you're calling from Elmina then?
Yes, I'm calling from Elmina.
Okay. Please go ahead.
Please, I wanted to ask a doctor a certain question. It's about my listing, my male organ. I don't know. For the last 1 week, I felt some pains during my urination. When I'm urinating, I felt some pains from my milk organ.
Okay, Abdul, that's not the conversation we're having, but I'm not a doctor. Please go to the hospital like right now. Or
Sure.
the doctor is here.
No, I think
You should go to the hospital. Okay. Abdul Karim, please go to the hospital. Do we have Karim Idrisu on the line?
Yes, please.
Okay. Please, you're on air. Let's hear you.
Okay, Mama V, I think the doctor is just explaining my problem.
Okay.
All that he said is just like he has, I've come to explain things to him, and he's telling me my problems.
So let's hear what you think your problem is.
Actually, in the night, I can't sleep. My problem is I lost my job, and I was paid some money. The money, I don't know what happened. I lost the money, and in the night, I can't sleep. I lose weight. I just know what I'm about. I contemplate. Suicide. Yeah.
Have you tried talking to anybody yet?
No.
Okay, just hold on. Just hold on, Doc. What should he do?
So, Karim, I think I don't know where you are, but I think that you can go to the nearest health facility, talk to the doctor there, and then I'm sure they would refer you appropriately to get assessed and get treatment if there's the need to be.
Okay. All right. Let's speak to Okofo Asante, and I hope I got your first name right. You're joining us from Kumasi. Good morning to you. You're on air.
Good morning, Mama P. I have this neighbor, and we all attend the same church. She has depression, and when normally it starts, she comes to the house. She would want us to talk things through. She shows symptoms that doctor talked of. She doesn't sleep at night, the entire night. She eats and never breaks. But then the issue was, the moment it comes, there's this guy at the house, I don't know whether she has a crush on, but the moment it comes, start calling him a husband. He wants to, sleep in the same room with the person and stuff like that, and it's getting out of hand. When you try preventing her, she gets worse. And I would want to know how to do it. Initially, she would come, we would talk about issues and others, and she will calm down. And the very first person she's close with is the father. But the moment she's depressed, she doesn't want to see the father. She even claims he's not the father and that he stole him. He stole her while she was a baby. So how do I deal with such a person? By the way, she has a specialist, she's seeing all right. But when the whole thing starts, she comes to my house, and I would want to know how to,
Okay.
deal
All
with her
right.
initially.
Okay. Thank you very much for sharing this with us. We will address that, but let's also speak to Abraham Aite, who is in Akosombo, and then we'll put the two together. Abraham, good morning.
Yes, good morning. I'd like to just make a small contribution. I think that most people who are depressed and perhaps refer from the general hospitals to specific hospitals like the psychiatry hospital have some sort of how do I say, some sort of attachment. It is like, why am I being referred to a mental hospital? So I like us to also address that point. So that when you are referred to, I think they are specialists who they have that kind of training to deal with, these depressive situations, unlike the general hospital who will just give a general situation about it. So I think let's take that also.
Absolutely. Thank you very much. Francis in Kansas is also joining us from Kumasi. Good morning, Francis.
Good morning.
Thank you for calling. Let's hear you.
Some years ago, at some point in 2011, I was diagnosed and was given some medications. And I think that it was actually working on my physio. And I got to a point, this medicine wasn't actually working. And I realized that naturally this thing could go. But I think that it comes with some sort of depression. After some time that, I've gotten out of the medicine and trying naturally to let the natural physiology to, remediate the situation, I get sometimes depressed about it. So I don't know. And as we speak now, sometimes I go through some severe mental, stress. So I don't know what is happening.
Okay. But Francis, are you seeing anybody now?
I think I read about it that it could go through natural means. So I'm not seeing any doctor now.
Okay. All right. I'll get the doctor to address that. But thank you very much for sharing. Patrick is in Accra. Good morning to you, Patrick.
Good morning.
Yes, Patrick. Thanks for calling. You're on air.
Please, Patrick.
Yes, sir. We can hear you.
Madam, how are you?
I'm very well, thank you.
Please, I'm very interested in the conversation asking depression, but I want to ask the doctor.
Okay, Patrick, I see what is happening. Kindly turn down the volume on that television set so we don't get any feedback. And if you call us, turn down the volume on your television set.
Is depression a condition or illness? Because when he was talking...
Okay, Patrick, you have to do that and then get back to us and give us a call back. Okay. Doc, let's start addressing some of the issues that have come up. Yes. There was a couple who called from Kumasi about the neighbor.
Yeah.
Yeah.
So I think that he also stated that the neighbor was already seeing someone. We don't know who specifically that is seeing. But if the neighbor is okay with him, then I'm sure he can try and then get the neighbor to see a specialist, maybe a psychiatrist. I mean, Confagnoche has a psychiatric unit and all that, so that might be the closest unit. But if he's already seen a specialist in that field, then I think he would have to still encourage her to go see the specialist. Otherwise, he can also talk to a specialist, and then if they need to, there's a need for her to be referred to see the psychiatrist. That would be done.
I'm also thinking that maybe this person that she's seeing may not have the updates as to the other reactions that he or Kofu, the neighbor, is observing.
Yes.
So maybe you might want to either follow, and I don't know how hard that will be, so you can give this person that she's seeing the updates in terms of how she reacts sometimes, all these things that you called to tell us. Okay. Am I wrong?
Yeah, I think that's
okay. Okay, and then there was Francis in Accra who says getting off the medication.
Okay. So I think the issue was, well, he got off medications and he still feels depressed sometimes.
Yeah, but I think he made a point of he was told that when he gets off the medication he will be better.
Okay. So
naturally.
Okay. So the thing is that some people can actually get it and then get out of it. Then again, I think earlier I explained that some people get one episode and after they are treated, they get they get better. They don't get relapses, but other people would also get relapses. So usually you treat for some particular number of time, you discuss with the person, and during that period, you try weaning the person off. However, if you try taking the person off and the symptoms come back, then you're likely to have to go back on treatment. So I think that what he has to do is to discuss with the doctor who he was seeing, who put him on the medications initially, let him or her understand what is happening to him now, and then I'm sure that appropriate interventions will be put in.
Can it degenerate? Because I remember him saying he's beginning to have some mental conditions. I don't know what's the link.
Okay, so the thing is that, I mean, depression is one illness. It doesn't also prevent you from getting any other condition. So there's something called comorbidity, where you can have depression, you can have other mental illnesses with it. So for now, I wouldn't be able to tell whether he already has another mental illness established, or it may be completely unrelated to depression, because we tend to see other mental conditions that occur, and then people also have depression with
okay.
it. Yeah.
All right. Abraham, I still remember the bit about education, but let's speak to Isahaku and Nana Dakwa, and then we will come back and wrap up beautifully with the very important question that you also asked. Isahaku from Zabzugu, good morning to you. You're on air. Okay, and I have to make this appeal, please. If you call us, please turn down the volume on your television set. Otherwise, we get feedback and the conversation won't be nice. So, Isahaku, if you have turned down the volume, we can have a conversation now. Hello? Okay, let me move on to Nana Dakwa in Sunyai. Nana Dakwa, good morning. Hello, Nana Dakwa.
Madam, good morning.
Good morning, sir. We can hear you. Please go ahead.
Thank you for getting me through. Good morning, madam. Thank you for getting me through.
Please go ahead.
Madam, thank you for getting me through. Please, I want to find out from the doctor if the condition of bipolar is curable.
Okay.
The condition of bipolar, I want to find out if it is curable.
Okay, all right. Thank you very much for your call. We're not discussing bipolar. Is it related in any way?
Okay, so yeah, so some way. Okay, so with the bipolar bit, bipolar has two extremes. There's the manic phase or the hyperactivity, elated mood phase, and they can also get depressed. So they can also get depressed at one side, but that's one form of depression. We can have those who are just depressed alone. So that's a separate entity. Bipolar people, yes, they can go depressed or they can go manic or the hyper state. But bipolar, just like other mental conditions, is chronic, meaning that the person will have to be on treatment for a long time to stay well. Chances are that when you go off your treatment, the symptoms will come back. Just like people with diabetes, hypertension, they have to be on their medications to stay well. So if you have bipolar, you also have to be on your medications to stay well.
Okay.
Yeah.
Are there people, and this is coming out of Abraham's question, Abraham called from Akosombo. Are there people who would refuse, even if they are referred to say you're coming from Pantai? Would they simply refuse to come because you're at Pantai?
Yes, it happens. I mean, it's about the whole stigma with mental health. The fact that you tell a person to go to the psychiatric hospital, already you mentioned psychiatric hospital, the stigma is there, like, why? What does this person think of me or something yet? So it's the whole stigma thing is what prevents people from coming to the psychiatric hospital. But then I think that mental health conditions are quite common. Things like depression can affect any of us at any point in time. So it shouldn't be something that should restrict us from getting the needed help. And I think the public should also get to understand that mental health, I mean, it's important. Our mental health is as important as any other aspect of our health.
Yeah.
So we shouldn't see it as a relegated area. It's part of us.
Let's spend the final 1 minute on, can you avoid getting depression?
Okay. So avoid it, that will be...
Can you prevent yourself from being depressed?
For prevention, I mean, as I stated earlier, some of the factors you can work on it. If I have the susceptibility to develop it, and especially those who have stresses, you may not be able to. But possibly for those that have stresses, probably when the stresses starts, you start working on it, probably get help, talk to someone earlier, but that will still cannot determine whether the person is going to get depressed or not. But you can at least try getting help early when you start feeling like that. But I'm not sure, I mean, it specifically would let you not get depressed, because others also get it without the stresses.
Okay, all right. I can walk to Pantai just like that and say that I want to see a psychiatrist.
Yes.
Okay, all right. And I think that I don't know what else we can say to to let you know that they're very cool doctors in all the mental hospitals. It doesn't mean that you necessarily have a mental illness. But even if you did, that's why it's an illness. So something can be done about it. So don't be shy. Don't stop yourself from going to a mental facility to see a proper doctor who can attend to you. Thank you very much for your time this morning.
Thank you.
I hope that we've done justice to this conversation. And if there's a need to call you back to do a follow-up, please allow us.
Sure.
All right. My guest from the Pantine Hospital, and he's expecting you if you need him to have a conversation with. So thank you for being here. Stay with us. We've got some show business coming to you, but not before I say happy birthday to Dosia Ama Ella of NIB. Is from Mrs. Quadison. Is your birthday. Enjoy your birthday. Dosia Ama Ella of NIB. Show business coming up next is brought to us courtesy Awake Purified Drinking Water.